only 5.5% of comprehensive eye exams resulted in a dedicated ocular surface or dry eye evaluation. And just 1.5% of those comprehensive eye exams resulted in an IPL treatment. But here's the kicker. When you dedicate, or when those offices dedicated an ocular surface evaluation, specific visit for that, when that visit does happen, the IPL conversion rate jumps to 29.78%. So I want to pause on that for a second. Hello and welcome to the Chris Wolfe Podcast on iCode Media. Today we're digging into one of the most uncomfortable but incredibly important topics that affects nearly every optometric practice. It's the gap between what we say we believe and what we actually do in clinic. Now, before anyone gets defensive, it's not about calling anyone out. It's not about being specific to a office or a doctor. That's not what this is about. It's about holding up the mirror and taking a good look, a good, honest look at the systems we built in our practices, or in some cases, the systems we haven't built. So today's episode is all about dry eye disease, specifically how we manage it and how we integrate technologies like IPL or LipiFlow or TearCare or RF into that patient journey and what the data is showing us about the actual behaviors happening in our practices. This is based on a pre-workshop survey and then a subsequent workshop that we did with Vision Source doctors ahead of a private practice improvement course. And let me tell you, the numbers just didn't whisper, they shouted. So let's dive in. As always, be sure to subscribe to the podcast, write a review, share it with your friends, and support those who support us. The most common questions I get include, what ophthalmological codes or evaluation and management codes should I use? What ICD-10 codes do I need to bill with this CPT code? What CPT codes can be billed together and what can't? And my favorite, how do I manage a patient who has diabetes who comes in for a quote-unquote routine eye exam? These questions really highlight the confusion and uncertainty that serves as a daunting hurdle for providers, makes it more challenging for them to care for their patients and provide those patients with the best opportunity for a lifetime of ocular health and clear vision. That's why we built iCode Education for this specific purpose. Our mission is to provide optometrists with resources to help you understand disease states, revenue cycles, and billing and coding so that you can put that on autopilot and truly care for your patients. Check out iCodeEducation.com. That's EYECODE education.com. We've developed a premier billing and coding bundle that includes all of our billing and coding resources in one place. We also have a 10% discount code just for listeners of this podcast. Enter the coupon code EYECODEMEDIA22 at checkout. We'd love to work with you. Check out iCodeEducation.com. Hello, dedicated optometrists. Are you looking for a way to support your patient's vision and overall eye health? Let me introduce you to Vision Edge Pro, a visual performance supplement that stands out in our profession. Vision Edge Pro contains a balanced blend of mesozeaxanthine, lutein, and zeaxanthine in a 10-10-2 ratio. This combination has been scientifically shown to increase macular pigment density, which enhances visual performance, including contrast sensitivity and vision in glare situations. Additionally, Vision Edge Pro provides 300 milligrams of DHA and EPA, fulfilling the daily requirements for omega-3s as recognized by the leading health organizations. This ensures your patients receive the essential nutrients their eyes need for optimal health. Whether it's for everyday screen use, night driving, or enjoying the outdoors, Vision Edge Pro supports your patients in seeing their best. Recommend Vision Edge Pro for your patients today and help them achieve clearer, healthier vision. Contact your local MacuHealth representative for more details. Vision Edge Pro, because your patients deserve the best in eye health. Go to MacuHealth.com and use the coupon code PODCAST2024 at checkout for special discounts. So let's talk about what we measured and why we measured it. So let me give you some quick context. And last week we ran a workshop focused on helping Vision Source practices optimize their systems for managing dry eye disease and specifically implementing technologies like IPL and RF. But before the workshop, we surveyed the doctors attending. We asked them about their current protocols, how often they're performing a dedicated ocular surface evaluation, how often IPL or RF gets performed, and what conversion looks like. The goal wasn't just to educate these doctors, it was to diagnose the problem before prescribing the solution and creating a framework around that specific patient problem. So we approach this with the same mindset that we use in Comprehensive Optometry Simplified, or COS. And COS, we teach doctors how to identify gaps between belief and behavior and build practical systems that move practices toward full scope, medically focused care. It's not about doing more work. It's about doing the right work with intention and repeatability. So here's what we found. Only 5.5% of comprehensive eye exams resulted in a dedicated ocular surface or dry eye evaluation. And just 1.5% of those comprehensive eye exams resulted in an IPL treatment. But here's the kicker. When you dedicate, or when those offices dedicated an ocular surface evaluation, a specific visit for that, when that visit does happen, the IPL conversion rate jumps to 29.78%. So I want to pause on that for a second. When we actually take time to schedule a separate dry eye evaluation, when we slow down, evaluate for differentials, and explain the condition to the patient, we educate that patient specifically, the conversion rate goes from 1.5% to almost 30%. That's a 20-fold increase. It's not because we suddenly got better at presenting IPL. It's not because the patient's condition changed. It's because the structure changed in the practice. The system we used to deliver the message changed, and it became more effective. So let's talk about beliefs versus behavior. And that's a real big one. Every single one of the attendees of this workshop, and there were over 50 of them, they all said they believe in treating meibomian gland dysfunction and dry eye disease, but specifically meibomian gland dysfunction with IPL. They said it was effective. They said it was actually the most effective treatment they had option, every single one of them. They said it was important. They said they were confident in the value, but when only 5% of comprehensive exams are leading to a dry eye evaluation, and 1.5% of those comprehensive exam patients are accepting IPL as a treatment from the comprehensive eye exam, the actions just don't line up with the beliefs. That's a classic definition of cognitive dissonance. What I say I believe isn't showing up in what I actually do. So I get it. There's reasons for this. Some of it's a workflow issue. In fact, much of it is a workflow issue. Some of it's from fear of sounding salesy. Some of it's lack of staff integration. Some of it's people just feel like they're too busy. Some of it's just inertia. But here's the thing. If we don't acknowledge this gap, we can't fix it. And if we don't fix it, we're underserving our patients, we're underutilizing our technology, and honestly, undercutting the long-term resilience of our own practices. CooperVision and the AOA have joined forces in a groundbreaking initiative to transform how optometrists treat children with myopia. The Myopia Collective aims to unite our profession and its allies to challenge the status quo and elevate the standard of care for children with myopia. Everyone is invited to become a member of the collective. By joining, you pledge to act in slowing childhood myopia progression. Membership includes regular updates and information about the collective's efforts, access to educational opportunities and resources, and insights from the ambassador optometrists who advocate for community policy and changes supporting the collective's mission. Click the link in the show notes to join the collective today. So let's apply the KPI mindset to dry eye. So let's get practical. Here's the metrics you should start tracking today if you want to align your actions with your beliefs before you even start building a framework, just to get your mindset wrapped around understanding where the kinks in the mechanism, right, where in the cogs in the wheel don't line up. So let's just say that you really like one type of lid scrub. We'll use Peak as an example. So you like Peak Pro as your lid scrub. And so you're dedicated that every time you see meibomian gland dysfunction, again, you can swap out Peak Pro for whatever your thing is. If you like artificial tears or warm compresses or some other lid scrub, doesn't matter to me. I'm using Peak Pro here, obviously, because that's one of my companies. But if we insert Peak Pro and we say every single time I see meibomian gland dysfunction and anterior blepharitis for a patient, I'm going to start that patient on a lid scrub, and I'm going to sell that lid scrub to that patient. So now we have, and I'm also going to be very direct, explain the condition for the patient. I might say, great news, Chris, you've got a new prescription today, but one of the reasons that your vision is fluctuating is because your oil glands have become backed up. And the number one reason for that is you have some overgrowth of microorganisms along your eyelids and lashes, and that's clogging those glands. And so your tears aren't staying stable on the surface of your eye. So I want you to start by using this lid scrub every single day, and I'm going to follow up with you in 1 month. So what you've done is you have created 2 tracking points. One is how many comprehensive eye exams led to the purchase of a lid scrub. And then now, once you do that, I've already triggered that patient. I've triggered a follow-up with that patient. So now we can track the second thing you're going to track. So the first thing is lid scrub to comprehensive eye exam ratio. Second thing is how many of those patients actually came back in your office that purchased the lid scrub. So now we can look at dry eye evaluation to lid scrub ratio, right? So we can run a report that tells us how many lid scrubs we sold, and then we could run a report in our EHR that tells us how many dry eye evaluations did we perform. And then the last thing is, if I used IPL, you could use RF, or you could use LipiFlow or TearCare, or whatever your widget is that you like. Then the next one you'd look at is, what was the rate of IPLs performed to the ratio of ocular surface disease evaluations that were performed? So how often are patients accepting the IPL when it's clinically indicated? So if you start with those 3, they'll tell you way more than your gut ever will about how your practice is functioning within the realm of ocular surface disease. You don't have to overhaul your whole practice tomorrow. You just have to start by measuring. Then build a process that supports what you already believe is right for the patient. And if you're wondering where to begin, this is exactly the process we walk you through in COS. We help doctors create systems that reflect their clinical priorities and make full scope care scalable, sustainable, and successful. So here's the bottom line. If you believe IPL or whatever the widget is that you are using is effective, and that dry eye deserves more than a quick mentioning during a comprehensive exam, then let's build a system that reflects that. Let's stop making dry eye disease, dry eye evaluations an afterthought, and start making it a structured part of the patient's journey. Your patients deserve it, your team can support it, and your practice will thrive because of it. If this resonated with you and you want to learn more about how COS can help you build these systems, check out the links in the show notes, whether it's IPL, dry eye, glaucoma, retina, myopia management, binocular vision. We give you the framework to make full scope optometry doable and profitable and comprehensive. Thanks for listening. And as always, take care of your patients, and that will take care of your practice. See you guys in the next one.